Hi, I'm Dr. Scampole. I'd like to welcome you, and I'm really glad you've come to the site. We've got a really special treat for you. I've taken 30 years of experience regarding hip, sacroiliac joint, disc, stenosis, and quite a bit more information to give to you in this 8-hour presentation, this 8-hour workshop. I think wouldn't it be great if you had an intake form that was broken down into segments, where each segment had questions specifically about either the hip or the sacroiliac joint or disc or stenosis? Well, that's what we've done for you. We compiled a number of questions in sections so that when your patients come to you and they complete this form, you're going to have a really good idea as to what's going on, what the cause of their problem is. In addition to that, we've come up with a 3-minute exam, which has about 7 orthopedic tests, which I think are really important for you to know. They're easy to do, they're highly accurate, and that will really lead you toward where the problem is. If you combine the orthopedic exam, the 3-minute exam, and that intake form, you're going to have an excellent idea as to what's going on with that patient. In addition to that, we've come up with a number of techniques that we think are going to make you tops in your field. They're going to make you stand out from the other people in your field. One of those techniques is included in a brief video at the end of this trailer. And I think you'll find it pretty interesting. It's in our scrape away the pain techniques. We're going to include those techniques which we think will really help you identify and treat the hip, the problem hip areas, the problem sacroiliac areas. And quite frankly, if you have a hip problem and a sacroiliac problem, you are going to have a low back problem. But what most of us get into is that rut where a person comes in and says, I have low back pain, and we treat the low back, either with trigger points or deep tissue or some technique, and we eliminate, we don't concentrate on those things that may be contributing to that low back pain. So the intake exam, the intake forms, those will help you identify if the hip and the SI joint are involved. And we're going to give you techniques to work on the hip, the SI, and the low back. I think you're really going to be happy with this course. I'm real proud of it. Took us a while to put together, actually about 30 years. So come and join us. If you want to increase your skill level, your clinical level, and just enjoy practice more, and be able to help more people with really serious problems, I look forward to you joining us. And now, that clip I promised you. Are we done? All right, so here we have Tony, a good friend of mine, who's agreed to let us use him as an example of how we would normally treat a low back problem. Now Tony, we've already done the orthopedic testing on him, and we know he has a hip problem, he has a sacroiliac problem, and therefore he has a low back problem. When we have a hip problem, it almost always includes the SI, and when we have those two, it's going to create a torquing in the low back. And if we have a torquing in the low back, eventually that's going to, first of all, stick the joints, make them so they don't move very well. And the torsion is going to eventually degrade the disc. When that happens, you're liable to have disc problems and certainly DJD down the line. And Tony has all those. So now that we've liberally put some cream on his hip, we're going to start to do a scan and treatment. So understand, when we're using these instruments, we accomplish two things at once. As we're rubbing the instruments over the tissue, we're scanning. We're looking to find roughness. The roughness tells us that there's adhesions there or scar tissue. How rough the tissue is an indication of how badly the involvement is at that point. So once we find it, then we actually want to go ahead and treat it. We might stroke a little bit deeper, maybe a little bit slower, but we want to find the barriers, and we'll talk about that in class. So what we're going to do first of all now is just go back and forth. We consider this a big circle, semicircle right in through here. We've got the hip joint, we have the ischium down here, and this is a little sulcus. This is a little valley right in through here. This is where our soft tissue is. We're going to be working the area coming around through here, all the way up around the top of the hip, and then around the front of the TFL. And this is where this sulcus, where this little valley, where this bunch of soft tissue is that we're going to be working on. We want to avoid working on hard tissue for the most part. We'll talk about that in class and the exceptions to that, but for the most part, avoid working on bone. Otherwise, we can irritate the periosteum and cause some serious problems. So working on the soft tissue is our goal. That's our objective. I'm using a small instrument at this point in time. There are two instruments involved with this set. This is the small one. This one works very, very nicely. And again, we're looking for areas of roughness. And right in through here, I found one. This is the deep 6 over and through here. And using this area, we're going to go ahead and have that fit right in the sulcus and go back and forth. I'm finding roughness. I'm not going too hard. I'm going just hard enough that I can feel the vibration through the instrument, feel the roughness through the instrument. As I start working my way up in this direction, I'm starting to feel a little bit more. Are you okay, Tony?
Sure.
And as we're going through this, we want you to constantly check with your patient, talk to them, find out how they're doing. This can be totally painless, or it can be quite painful. In Tony's case, he handles this very, very well. And I'm not finding too much up and through here. If we take the long axis of the thigh, we run it up like this, right in through here, we're going to come around to the PSS. Just medial, or rather lateral to the PSS, right in through here is where we're going to find a bunch of tissue. And this is a key trigger point. So when we're working on hips, we want to look for scar tissue, but we don't want to forget to work on this area right in through here. It's really key. So as I come down and through here, I'm feeling more vibration. And we're going to check different angles, different directions of stroke. In this direction I feel a little bit, not too much. When I go in this direction, I'm feeling more. Right in through there is where I'm feeling the most vibration. And we're picking up some vibration over here from the minimus and the medius over here too. But right now, I'm just concentrating on the PSS, this bump right here. And as I said, moving in this direction is the direction that gives us the most vibration. Can you feel that, Tony?
Mm-hmm.
That's pretty significant right there.
Yeah.
So not pressing terribly hard, again, just hard enough that we can go ahead and make contact with the fibrosis that's deep in there. Now I'm feeling quite a bit up and through here. So once we've worked this area here, the knee being up where it is, it tightens this tissue. Because it tightens this tissue, it also tenses some of the tissue in the low back. So what we're going to do is, our line of direction is going to be here, and then here. If I come up here, can you pick that up, Ruthie?
I can.
If I come up right in through here?
Mm-hmm.
Okay. So now we worked on the hip in here. The knee is up. It's in flexion. We've got some tension of the tissue back and through here. So I'm going to bring this down a little bit over here. We're going to go ahead and put some cream on the low back. And we're going to put it on the T-spine. I appreciate that. Thank you. So our order of treatment so far is to work in the back of the hip, continue right up through the low back, and then through the mid back. Let's see, if I'm in like this, Ruthie, can you see that okay?
Yes, I can.
Okay. So right here we have the PSS, and here we have the spine, and right in through here, here's our L5. And we'll go through this in anatomical landmarks and how to pinpoint these areas in class, but for right now, understand I'm working on the L-spine, starting right down at L5. Now right at L5, L4, L3, these are our primary areas to look for scar tissue. It can be very, very tender, and a lot of times we'll have fatty cysts right in here too. So you want to look around, use your finger, and Tony has one right in through there. Fatty cysts are lumps. They're very mobile, they're soft, and as you push on them, they'll move around. Unfortunately, they're very, very tender as well. So if we scrape on them, Tony's not going to be real happy. So we want to try to localize those as best we can. Put our thumb on it so we know where the landmark is, and then scrape around the landmark indicated by where our thumb is. Scrape around that fatty cyst. So we're going to be moving in an upward direction, downward direction. Primarily at this point in time, all we want to do is get the upward and downward motion. So the instrument itself is going to be adjacent to the spinous processes, not on them, because that's really, really uncomfortable and can cause damage down the road. So we want to make sure that we're placed next to the spinuses. They are here. My thumb is on them. The instrument is adjacent to it. We're on soft tissue only. We're not on bone. And we're just going to be moving up and down.